And I'd like to introduce myself, welcome everybody, and thank you from the bottom of my heart for inviting me to speak to the Smile Train community. I have, for many, many years, been aware of the organization and have been in awe and admiration of the people who give their time and effort to taking care of people all over the world. And I'm just so pleased to be asked to join you today. I've been very privileged to work with families and children during much of my career in New York City at New York Presbyterian Hospital, as children have gone through serial surgeries to correct facial differences that they were born with. And I've tried to understand how I can best optimize their lives, uh, their response to surgery, and identify any concerns that might arise both during the treatment, afterwards, and perhaps years later, so that we can encourage all the families to do the best they possibly can in the course of their lives after craniofacial surgery. I've also been very privileged to work with a wonderful surgical team, interdisciplinary team of dentists, orthodontists, speech and language therapists, and social workers, as we've tried to work together to help the children who come from far and wide for this kind of work. One of the things that I've done in my career is to try to identify what happens when children undergo invasive medical procedures. I've done this work in populations of children going through cancer treatment, diabetes care, organ transplant, and then, of course, correction of cleft. And all these things are invasive in that things happen to the child that perhaps the child's not old enough to understand what's going on. It's going to be uncomfortable, frightening, painful, and we do everything we can to prepare those children to not be too afraid, to be comfortable, to be free of pain, and to have a good physical and emotional outcome. And in doing that, we really understand that if we fail to control pain, if we fail to control fear, we can set the child up for difficulties later. And there have been occasions where I've had to help families adjust to things like fear of dentists or fear of orthodontists, even though it's fairly routine to give dental and orthodontic care to kids as they grow up. One of the risk factors that we think about for kids who go through surgery, in addition to being afraid of doctors or afraid of painful procedures, is that if they're aware, if they're old enough to be aware that they have any differences that they have from their peers, they can appear to be shy, a little bit socially withdrawn. And this can develop into introversion and shyness at times. And there are psychotherapeutic approaches to really helping kids deal with that, so that it's not terribly painful and frightening to go to school and be a part of a community of kids. What I'd like to concentrate more on in my talk today is how being born with a cleft can influence the growing ability to communicate between that child and other children, and between the child and his or her parents and caregivers. The cleft is something that involves both the facial musculature and the feeding process and the breathing process and eventually the vocalization. And when it's corrected, all those things can fall into place nicely. And yet sometimes there are critical periods in early development where children can lag behind in their ability to learn to feed and vocalize and swallow and to develop facial expressions that involve communication. One of the first things that happens when a baby is born is that the mother learns to feed that baby, often at the breast or with a bottle. We know that with kids born with clefts, there are special techniques that we offer to help facilitate feeding, because natural feeding can be difficult with kids with clefts. The other thing we know about early feeding is that feeding is the first experience of give and take between a parent and the child. I give you food, the child receives the food. The child swallows the food, the parent is happy. The child burps, the mother is excited. Those are actually considered proto-conversations, the give and take between what I give you and what you give me back. It doesn't sound like a conversation, but the brain uses those give and takes as the building blocks for future communication. The second aspect of communication that we see that's more obvious, perhaps, after feeding, is the exchange of facial expressions. How wonderful it is the first time your baby gives you a facial expression, a grimace, a smile, a frown, something that you don't really know what the child's thinking, but your instinct is to mirror that baby's expression. And when you mirror it, the baby mirrors it back. We think because there are neurons in the brain called mirror neurons that instinctively lead us to facially mirror one another's facial expressions. When there's a give and take, we think of that as the beginning of communication and one of the building blocks of human language. We don't know that other animals do this, but we think some of the other primates do, but we're absolutely sure that the ability to exchange facial expressions is a real key building block to being able to connect verbally and communicate with your child. The next building block that goes on after that has to do with vocal sounds, and those often go with facial expressions, whether they're intentional or not. Babies eventually begin to babble, intentionally or unintentionally. And we understand from linguistic research that babies are born already having in their ear some of the vocal sounds of their native language, of their mother tongue. So if a baby hears Chinese in the womb and they're born into an English-speaking environment, they're going to have to learn a foreign language to some extent. If the baby is born and hears her or his native language spoken, they're going to naturally begin to babble using the sound elements and consonants of that language. And the adult who hears that instinctively mirrors it back by babbling back. Even the most proud intellectual parent who promises they would never speak baby talk to their baby can't help but babble back when the baby babbles to you. It's kind of a joke that we tell to some academics who promise that they would never do that. That babbling, more clearly than even the facial expressions and the feeding, become the building blocks for actual verbal communication. Because think about how the babbling can turn into mama or papa, and the parents just get very excited and then stimulate that and give it back to the child in an enhanced way. When the child has any facial issues that make it difficult to express consonants or vowels, it can sometimes frustrate the parent, and they can become more easily fatigued and less likely to mirror back every vocalization. So what we try to do in preparing parents of kids with clefts is to be more vigorous than they would instinctively or naturally be in vocalizing to their child. How do we do that? We encourage them to sing to the child, to read children's books to the child, to babble first and let the child babble back, to not wait for the child to lead you, but for you to lead the child. The natural course of things is for the child to teach the parent how to communicate. But in our case, sometimes we like to get the parent on board doing as much stimulation as possible to really speed up and facilitate neurological development, social development, and emotional development. All those pieces put together, we think, can really facilitate thriving and encouraging children to grow up and live a wonderful life despite any mild deficits that they grew up with or were born with. We don't really think that most children suffer this way, but some kids are more vulnerable than others. And we like to make sure to give them a head start. So with that, I'd like to thank the community so much for listening to what I've had to say. And I'm very eager to take questions from the community. And if there are any things that you think I've missed, I'd like to learn from you. And thank you very much.
Hello, Dr. Gorfinkle. Good to see you. Thank you for great insights this morning. I'm Justin McCarthy, and I'm a Senior Director of Development for Smile Train on the West Coast. And I know you're joining us from wonderful New York City.
Yes, I am. I'm very glad to be here and honored to be here.
Well, we are so glad to have you sharing insights. And I know you started your talk off saying you're in awe of some of the folks at Smile Train that are doing great things around the world. And we're really in awe of the work that you do to encourage children and families. So thank you for that work. I want to encourage everybody, we're live now. So I want to encourage everybody to use the chat function to send us any questions that you have for Dr. Gorfinkle. We want to make sure that we get his expertise while we're all here online. And while the session was going on, we received a couple pre-questions. So I'd love to start out with those. And then we have a little bit of extra time. So we'll just see how the conversation goes. How's that?
Sounds great.
All right, perfect. Let's jump right in. You mentioned that many of the younger patients that you work with develop a fear of doctors and obviously painful procedures. So what are some of the strategies that you deploy in order to help these patients combat those fears?
We try to treat even the very smallest children as human beings and equals as adults. We try to understand them as having a full complement of feelings and emotions and understandings of their world. We
Okay.
assume that children know more than we think they know about what's going on. And yet, if they're not told what's going on, what's going to be done to them, what kind of procedure it is, what anesthesia is, and so on,
Right.
then they start making up stories in their minds of what they're afraid it is rather than what it really is. And we always say that the truth is the best possible policy because kids are rarely that afraid of the truth.
Love it. Very cool. We're already getting a lot of questions here. We have someone sending a note in. Their son is 14 months old and will be having palate surgery in the next 3 months. He is babbling a lot and trying to communicate, which is wonderful. What are some sounds that we can help him with?
So that the vocalizations that kids with palate issues have sometimes have to do with the ways that your tongue touches the roof of your mouth and the way that you breathe when you talk. And so
Okay.
what you do instinctively when you hear a child who's speaking a little bit off the beaten path of the native language is that you instinctively speak back to the child with a pronunciation that's more understandable. Some
Okay.
kids with clefts also are born with auditory issues, and so that adds an additional complication. But absent that, kind of what happens is you as a parent will instinctively not correct the child, but shape the child's auditory input because the child hears his or her own vocal sounds quite clearly in their head, just as you do when you speak.
Okay.
But he or she also hears what you say back, and that's so true. Children's minds are so flexible, so plastic, so quick to learn that they will constantly adjust what they say based on what they hear.
Amazing. Very, very cool. We have another question from Kara Jackman. How does the lack of early nonverbal communication impact emotional regulation and growth later in life? Do you have some thoughts on that?
Yeah, and children who are for any reason neglected or whose parents are unable to be there and to stimulate them verbally sometimes don't learn right away what the emotional vocabulary of the culture is, what a smile looks like, what a frown means, how
Sure.
to express anger.
Uh-huh.
And so those kids, they have to play catch up. And it's possible to do that, but with every year that goes by, it's more difficult. And I'm always amazed at how resilient children are. Even children who were brought up, say, in uh, refugee camps and, say in Lebanon and really
Okay.
had very little good stimulation early on as
Wow.
kids. But, we can catch them even in their teens and they can catch up as long as there's a lot of love and emotional support in the mix. We really
Love it.
need to have a multi-dimensional approach with psychology, family therapy, and as well as speech and language therapy. I don't think I mentioned speech and language therapists in my earlier talk, and they are really critical, not only in teaching kids how to articulate the language, but also how to express meanings and
Sure.
feelings through language.
Love it. Great, great, great stuff. Here's another wonderful question. Our family is bilingual. Should we focus on one language as our baby starts babbling, or continue with both? And Sophie says, I speak daily in my native language with my family and English with my husband. I think it's a great question.
It's a wonderful question. Everything we know about multilingual families tells us that children benefit from that. And if you can keep doing that, that's really great. Some children with specific learning disabilities, having nothing to do with cleft, do occasionally show up later in life with difficulties in language processing in one or more languages. And those kids, we often suggest that they go down from 2 languages to 1 language, say in middle school or high school. But as long as you're stimulating the child in multiple languages early in life, you're really ahead of the game. You're giving the child's mind a chance to grow and expand in a number of ways that other kids are not privileged to be able to do.
Very good. So keep that up, Sophie, for sure, right? That's good stuff.
Absolutely. Great.
A follow-up question. We are working on, this is a different party that asked one of the initial questions. We are working on sign language too. This has really been helping us along with saying what we are signing. I do worry with palate surgery coming so much later in life, could his speech be affected?
Having sign language is an additional way to enhance communication and expression, both emotional and verbal and cognitive. So there's really no shortfall in adding sign language onto speech communication. In fact, we know from the community of hearing impaired and deaf children who are later neurologically given hearing through surgery, those kids do much better with language if they're given a head start with hand and sign communication, and they take to vocal, oral, auditory communication just as well as kids who never had it, maybe maybe even better. So again, just like a multilingual family, adding sign is a great thing as far as all the research seems to show.
Love it. Just another way to communicate.
Yeah,
cool.
And probably a creative and enhanced way that those of us who don't have sign, we wish we had sometimes.
Love it. Love it. Another question, is it possible to get a clear speech as an adult if the palate was repaired when the child was all grown up?
It is. However, it takes more effort, more work. The vocal musculature needs to be adapted and retrained to create some of those vocal sounds.
Okay.
Think about a person who moved from a foreign country and speaks with an accent, right? Okay. People with a cleft, maybe you could say speak with a cleft accent, but it's something that can be unlearned with practice if you have the drive and the willingness to work on the vocal musculature.
Great analogy. When do babies begin to mirror facial expressions? And it's kind of a 2-part question. Are there any specific expressions you would recommend that parents use as well?
It's really not necessary to divide it up into specific expressions because you can't help it. If you've ever looked at a baby, when they make a face, you just can't help making a face back. What I will say is that this is a sort of a fun fact about human development. Because we have such large heads compared to the other primates, we are not born when we're fully developed. So technically, the fetal stage ends when we're already 3 months postpartum. And it's at that point that we're fully functional biologically and much more ready to be physically independent. And it's at that stage, the age of 3 months of age, when your vocal and verbal expressions begin to become intentional. We talk about that as the psychological birth of the human infant, when the child socially wakes up and parents recognize that child is becoming more clearly a personality in the family, whereas up until 3 months, they're just kind of looking like a baby. Although many loving parents will tell me that I'm not knowing their child, who's an absolute genius and was a baby well before 3 months.
Of course, that's good. I think people are concerned about kind of doing it correctly. Another question that we have, and I think you're speaking to that it is natural and it's and there's no correct way. But another question is, are there certain sounds that are particularly effective when it comes to vocal exchanges with babies with cleft?
Well, what I would say to that is when you sing and read children's poetry, for example, a Dr. Seuss book in English, those books emphasize the fun and powerful aspects of human language that children can hear very well. And singing naturally exaggerates those sounds.
Okay.
So even a book called Horton Hears a Who, that H sound is a very hard sound for children to get, but the P and the T and the K sounds are much easier to have. So as long as the hearing is intact, the child's mouth will catch up with the hearing and they'll be able to make those sounds. All I suggest is that when you sing to the child and read to the child and speak to the child, that you emphasize those vocal sounds and not mumble over them yourself. Speak as if you're a TV announcer, and not just having a regular conversation.
I love it. I love it. And so the book that you're reading or the song that you're singing doesn't need to be age appropriate. It really is about seeing the expressions and hearing the sounds in that narrator voice, if you will, or in that with that enunciation. Yeah.
And I would add to that it's really helpful if it's fun and playful.
Okay.
If it makes you laugh, if you have natural emotional expressiveness as you're speaking, reading, or singing to the child will pay more close attention to it. Imagine comparing singing your favorite nursery rhyme to a child versus reading the phone book. That you're going to get the child's attention if you really love what you're saying or singing.
Yeah, so it's as much as the person doing the reading, if they're enjoying the process as well.
Right, exactly.
I love it. I love it. I love it. We're getting a little close on time, but we still have time. So I'd love to encourage anyone to keep sending us questions. This is kind of a big one, Dr. Gorfinkle, but based on your experience, is there kind of a number one piece of advice that you would share with parents that are expecting a child with cleft? That's a big one.
Yeah, I think that I've been thinking about this and thought about it more when I listened to the wonderful keynote speech this morning, an hour ago. And what I would say is this, that every child has his or own personal journey through growing up, maybe a little different from his or her peers.
Mm-hmm.
And to recognize that your child is and will always be unique, and to honor the uniqueness of that child's journey, to convey to that child that you will love him or her how she or he is, how she or he decides to grow up. If he's shy, if he's outgoing, it doesn't matter. We try not to pathologize anything about our children despite any kind of differences that they're born with. In our craniofacial surgery service, we had kids born with very severe midline deformities that were quite startling and difficult to look at birth. But, the children were loved by their parents nonetheless just as much. And to the extent that that could be expressed to the child could receive it. They had a chance to grow up believing in themselves, just like your keynote speaker.
All right. I love it. I love it. One other question related to kind of the family dynamic. Can brothers and sisters and cousins play a role in this as well? It seems like everybody in the whole family unit can, and in the community really, can be part of this journey.
Yeah, I think that brings up, perhaps the issue of bullying. If a child is mistreated by the social circle, say in elementary school, it's often the siblings and the parents that go to the child's defense. But if you do that, and when you do that, you're going to want to do it in a way that keeps empowering the child to stand up for himself, to not make him or her.
Any thoughts on that? Are there some tools or thoughts that you have specifically on that?
Sometimes kids need words like back off, or don't treat me like that, or don't talk to me that way. I'm just as good at baseball as you are. These are language bits, they're sound bites that sometimes kids forget in the heat of the moment.
Sure, absolutely. And I think we all need coaching like that, but yeah. Especially in those challenging situations. And yeah, that's interesting. But really, the goal is to empower the child to be able to manage it and give them the tools to do that.
Absolutely. And the other thing I would add is that if you can give the child contact with anyone else who's been through a similar journey, that's going to really help make them feel less alone and more like they're part of a community of kids that they can turn to for understanding and sympathy and empathy.
I love it. You work with people of all ages. What's that like? How long do you work with a patient?
I have a private practice now in New York City where I take referrals from the hospital from people with all different kinds of chronic medical conditions, of which cleft is one, but also diabetes, cancer, organ transplant, you name it. And so living with chronic illness is a unique challenge in confronting our somewhat difficult medical system that maybe you all have feelings about, given that it's in the news lately. And in doing so, we really advocate for taking charge of your health care and your medical care, telling you that you are the boss of your care. You
I
make
love
your
it.
decisions about what you need and what you don't need.
Very
And
cool.
be proud of those decisions that you know, for the most part, because we have so much access online to medical information, that you often know more than your doctors and your medical team about what you need.
Really cool. And that's great to hear, because I think people go in not thinking that, not feeling like they know, but by educating themselves online and by their community, reaching out to people that are experiencing the same thing, it can be really powerful and encourage you to make those decisions as we all go down the path.
Yeah, for example, I encourage teenagers and young adults to have direct line to their doctors and medical team and not have the parents make the call or the appointment or the prescription request for them, to learn how to access their own medical care all by themselves, to develop their own relationship with their doctors and nurses and speech pathologists and language specialists.
Very
Uh,
cool.
so that as they grow up, they make it their own, and they don't rely on other people to tell them what they need or what's wrong with them.
They're managing the process and they have confidence to do that.
Yeah, yeah.
Brilliant, brilliant. Dr. Gorfinkle, such a wonderful breadth of information. We're so grateful that you shared time with us and that you were so open to answering direct questions from this great audience of people tuning in for CleftCon. So thank you so much. I think we're gonna shut down now and everyone can move on to the next session, but we're really grateful for your support. Keep up the great work. Thank you.
Thanks very much, Justin. And I really appreciate your inviting me to take part in this. Thank
Come
you.
see us in Long Beach. Thank you so much.
Will
All
do.
righty. Bye-bye. Thank you, everybody.